Hello, would you like to know how to get approval from Ministry of Health to conduct screening and triaging, as well as set up health screening booths related to COVID-19? What is the difference between screening and triaging application and health screening booths? How to get training to conduct the screening? Stay tuned to this video as we give out tips on how to get your applications approved within 24 hours. First of all, you need to know what services you intend to provide. Are you going to conduct screening within the compound of your clinic? Then, you need to submit the application to conduct screening and triaging. If you want to conduct the screening outside the compound of your clinic, for example at factories, shopping malls or football field, then you need to follow the procedures to set up health screening booths. Who can apply for these services? Well, if you own a private medical clinic, general practitioner, registered under Act 586, you can apply for both screening and triaging approval and health screening booth approval. However, private dental clinics are ineligible to provide this service. Private hospitals, ambulatory care centers and specialist private medical clinics can only provide screening and triaging booth, but not the health screening booths. Part A is how to apply for screening and triaging approval. Step number 1 would be to get the personnel trained. Identify a minimum of 3 personnel that would perform and assist during the procedures. Currently, the training recognized are courses provided by Family Health Development Division, BPKK, or its proxy. It is a one-day course and participants will be given an e-certificate once they complete the training. You may contact BPKK for details on the schedule and venue of the training. At least one doctor is to lead the team and perform the swabbing, and it is compulsory for the doctor to attend the training. The other 2 personnel can be of other categories, paramedics or clinic assistants, who may help in performing other tasks. Frequently, the applications received by Ministry of Health were delayed in getting approved due to reasons such as the personnel's named or untrained. Some clinics also sent the applications prior to receiving the e-certificates without proof of training. The Ministry cannot approve the applications yet. There are also applications which named less than 3 people to perform and assist with the procedures. Lastly, if the personnel named is also the person to perform for other clinics, this can also delay in obtaining the approval, as the Ministry have to check and verify regarding the discrepancies. Step 2 is identifying the laboratories that you are going to collaborate with. You need to refer to Annex 4 of Guidelines COVID-19 Management in Malaysia No. 5, 2020, updated on the 22nd of May 2020, for the list of 14 private laboratories recognized to conduct the tests for COVID-19. A mistake commonly done by applicants is submitting the name of laboratories which are not recognized by the Ministry. Step 3 is you need to study the guidelines thoroughly. This guidelines is available at the website of Ministry of Health. Please pay attention to Annex 2F, which outlines the steps to conduct the testing and the procedures that need to be taken if the client's results turn out to be positive. Many applications encountered gave wrong justifications on providing the services, such as screening symptomatic cases or suspected PUI cases. These cases are screened by the government facilities. Another commonly found mistake is not arranging transportation for clients whose results are positive. The next step is preparing the schematic diagram. Identify a suitable area where the procedures are going to be done. Is it going to be done at the back or at the front of the clinic? If at the front of the clinic in the car park area, would it hinder the traffic, and would the local authority approve of the location? If done at the back of the clinic, is the area clean for medical procedures? Would the patients come walking or in their cars? Once you are confident that the area is suitable, prepare the diagram, accompanied with clear explanations, using a computer to ensure that it is legible. With regards to the location, commonly found mistakes are the unsuitability of the area proposed by the applicants. Amongst others, the area chosen are confined and has poor ventilation, for example parking lots at the basement. Some clinics also propose to conduct screening at the back alley of their clinic, which is narrow and dirty. Several areas proposed also overlaps with applications by other clinics. This is an example of patient's flowchart which outlines the procedures and patient's flow. On the other hand, this is an example whereby the schematic diagram sent initially is unclear, with regards to patient's flow and location of the procedure. After it was amended, the patient's flow is clear and easily understood. This is another example of schematic diagram with clear explanation on the patient's flow and function of each area. This is also an example of schematic diagram for a clinic providing drive-through screening in front of the clinic. Other mistakes frequently encountered are the applicants intend to use rapid test kit as a method for screening. To date, only RT-PCR is allowed for the private medical clinics. Another important thing is you need to ensure that the patient flow is one way to prevent cross-infection. Once you have everything ready, email us all the details and supporting documents, with the name and telephone number of the certificate of registration holder. If the application is complete and comply, we will issue an email approving the application within 1 working day. Now we go on to Part B, which is how to apply for health screening booth approval. To apply for health screening booth outside the clinic's compound, you need to follow Step 1 to Step 4 of the procedure to apply for screening and triaging booth within the clinic, which is get the personnel trained, identify the laboratories, study the flow and prepare the schematic diagram. Lastly, you need to download the health screening booth form from the Medical Practice Division's website. Once you are at the website, click at CCAPS located at the left column of the web page. Subsequently, click on the Minister's Directive Number 2 year 2019 at the bottom of the web page. Download the directive. The form is at page 6 till page 8 of the directive. How to fill up the form. First, fill up Part A with the name, address and registration number of the clinic as stated in Form B or Form F of the clinic. Next, fill up Part B with the details of the person in charge as stated in Form B or Form F of the clinic. Next, fill up Part C with the details of personnel who will be on duty at the health screening booths, especially the person to perform. Do not forget to fill up Part D with detailed and complete information regarding location of the booths. Do take note that the location of the booth must be within the same state of the clinic. Lastly, the declaration must be signed and stamped by the holder of the certificate of registration. Email the form and supporting documents, and if the application is complete and comply, wish and email the approval within 1 working day. This is the checklist for the application. You may use this to check whether the application is complete. With that, we hope that this video have helped you to understand the procedure to apply for screening and triaging booth related to COVID-19 better. You may forward any query that you have to the email address above, and please follow our social media to keep abreast with the latest update. Thank you and have a great day.